Tourette disorder is another psychiatric disorder. However, this is a different disorder in that it is a movement disorder. These are disorders where these children have multiple tics. Now, these tics could be motor, these tics could be vocal, and what's important about these tics is that they're going on for more than a year, and typically the patients are under the age of 18. They truly do not know what causes these disorders, but they do believe that many of them are autosomal dominant. And there is an interesting association between attention deficit disorder and Tourette's, as well as obsessive compulsive disorder and Tourette's. So you can see that about 50% and 40% respectively are associated with Tourette's disorder. Now, they think the theory of Tourette's disorder is that these are kids that have too much dopamine, too much of the noradrenergic neurotransmitters. So the treatment will always be to reduce the amount of norepinephrine, to reduce the amount of the dopamine, and that's why the antipsychotics are routinely used. Now, this is not that common. It occurs in about 5 cases out of every 10,000, but it's much more common in boys than in girls at an incidence at about 2 to 1. The average age of onset is about 7, and what typically happens is that motor tics will usually be present, such as clapping, such as snapping your fingers, marching up and down, shrugging your shoulders, moving your head. And the patients can also have vocal symptoms, howling, clicking, murmuring, doing any kind of noises which would be consistent in nature. Typically when you're stressed, the tics tend to increase. Typically when you're stared at, the tics tend to increase. What tends to decrease these sleeps, or they tend to be absent actually, is when the patients are sleeping. Coprolalia is seen in about 10% of the patients, and this is where you have utterance of foul language. So these kids are going to blurt out obscenities, and that's a clear indication of Tourette's, especially when you have questions on the test. Now, of course, the most common associated findings will be attention deficit, hyperactivity disorder, and obsessive compulsive disorder. So it is very common to find questions where they give you a child who has Tourette's with ADHD or with OCD. And it's a very lifelong illness, so any kind of stressful situation will have an exacerbation of your symptoms. And the treatment will always be antipsychotics. And when given a choice between high-potency antipsychotics like haloperidol versus atypical antipsychotics, for example, like risperidone, then you should always choose the newer antipsychotic, the cleaner antipsychotic, which is risperidone. So typically antipsychotics are the drugs of choice. However, clonidine and benzos like clonazepam can be used in some situations, but the overall treatment will be with the antipsychotic, lower the level of dopamine, therefore you reduce the tics. Let's look at a case. A 13-year-old boy is referred by his junior high school principal for evaluation of his short attention span and inability to sit quietly in class or on the school bus. He has a quick temper at school and at home, and his peers tease him about his temper. Think about everything that I've discussed so far. What you have here is a child who probably has some attention deficit disorder. How do we know that? Because of the attention span and the inability to sit in class. What do you recall was the most important thing that could happen to children who had attention deficit hyperactivity disorder? Was it affectual blunting? Was it autistic mannerisms, conduct disturbances, grandiosity and inflated self-esteem, or mental retardation? And if you remember, anyone with ADHD has low self-esteem, have impulsivity, and they tend to have behavioral disturbances. They tend to have conduct disturbances. So the answer here would be letter C.